Hey everyone, I'm Allie Abadi with Fidelis Care, and this is Fidelisaurus, our Fidelis Care mascot. He is our promoter of healthy habits. Thank you for joining us. We are live from our downtown community office in the heart of Utica, and we will be here until 5 p.m. today. So if you're in the area, come on down to 209 Elizabeth Street where we're having our Smiles That Shine event. Kids ages 1 through 12 can come on in and get a free teeth cleaning or screening from our dentist that's here with us today, Dr. Dina Pegler. Thank you so much for joining us.
Thanks for having me.
So February is National Children's Dental Health Month, and all month long we have been working to promote the benefits of good oral health for children. So any of the information that you see today you can find online at fideliscare.org/smilesthatshine. So we have some questions for Dr. Pegler to give us some great information that you might be wondering at home about children and oral health. So we are going to get started. Okay, so what age should kids first start coming to the dentist?
Well, most kids start getting their first tooth around 6 months. And usually you want to start bringing your kids 6 months after that for a checkup. Whether it's to take a look in their mouth if they let you, or if not, just to ride in the chair just to get familiar with the environment. Though some kids are little and they let you do everything. So it's just hit or miss, and you try to get as much as you can done and then have the parents follow up and start bringing them on a regular basis.
So start early and really get them
as soon
used
as
to
possible.
Great. Here's a good one. So a lot of kids obviously use pacifiers when they're babies, and a lot of kids use bottles. We always hear that maybe it affects their teeth. I'm just wondering how that does affect their teeth, the development of the teeth, and is there a time when they should stop using them?
I would stop as soon as possible. I mean, the thing is, the teeth are the palate's soft, the teeth are developing, and what happens is if you keep the kids sucking the thumb or the pacifier in too long, the jaw develops malform. They'll get like an open bite, or the teeth will flare out, and they take that with them. And so you want to just have it stop. There'll be less orthodontics in the future,
Which is good.
Better for the parents, less money.
So baby teeth. Obviously, they're not permanent. We know they're going to fall out. But how important is it that we take care of baby teeth now?
Okay, well, first thing is it's good to get them in the habit.
Right.
So if they start taking good care of the baby teeth, they're going to take care of their permanent ones. And we all know the permanents are the permanent ones. But they're also placeholders. So you need them there. If one comes out a little too soon, whether it gets knocked out or due to decay, then the spaces are going to close in, and the real tooth that's coming behind it won't be coming in that exact position. So think of them as just holding the place, and it's a good preparedness for the future.
Great. All right, sugar. Is it really that bad for our teeth?
Well, I mean, if you're constantly eating sugar, yes. You can have it a little bit in doses, and they say if you're going to have sugar, you have it all at once. Then having it a little bit through the day. Have it, brush your teeth, and then you're good. I mean, it's hard to say never have sugar again. Everything has sugar in it.
Okay. So that brings me to our next question. Are there certain foods that we should absolutely avoid, and are there some that are actually good for the health of our teeth?
Well, I mean, vegetables are the best things for the teeth, but it's hard. Little kids love sugar. Everybody loves sugar. Even potato chips have things in it that stick to the teeth that can cause cavities. But again, it's all moderation, and brush your teeth as soon as you're done eating, and you should be fine.
Good. So what are some ways that parents can help kids prevent cavities at a young age?
Okay, well, besides nagging and threatening the kids,
right,
okay,
right.
you
We
can
all try, but
exactly, and you can't help but not. But you can set up motivations, like follow mommy and daddy, or even have a chart where they get rewards daily or once a week. And I'm not talking a big reward, a little sticker maybe, or just something to get them motivated. And then the toothbrushes today are fantastic. Hello Kitty electric toothbrushes, Superman toothbrushes, little rotaries. And I mean, kids love it. I have little kids that come in, they're so happy brushing. The toothbrush sings to them. So they love it. So that's the best thing. And the toothpaste, they have grape with sparkles in it.
Yeah.
I mean, I'd love it. I wish they had it for us. So it's fantastic. And those are all ways to get the kids excited.
And that kind of answers this a little bit, but some tips to get kids brushing and flossing every day, because it is really important.
Well, you have to watch them. That's number one. You have to be on top of them and just make it a fun activity. You know, brush with daddy, or brush with mommy, or we're going to have so much fun doing it. Not like you have to brush your teeth. It should be like, it's a fun thing. We all want to do it.
And then, so my last question, and I know, I mean, I have a 5-year-old at home who has been wanting to brush his teeth on his own for a long time. At what age can they do it on their own? Because they're not as good
Yeah, the
as
dexterity.
we are.
Yeah. Well, the dexterity comes around 5 or 6 years old.
Okay.
So a good rule is when they can tie their shoes, then they can start brushing their teeth. But don't just let them go on their own.
Right.
You still have to be there to monitor it.
Okay.
You know, you don't want them eating all the toothpaste. Also,
Right.
you want to make sure they get all the areas. So maybe even when they start, they go first. Mommy or daddy can touch up a little bit.
Perfect. Well, thank
Okay.
you so much.
Oh, this was so much
for being
fun.
here with us today. And just remember, if you're in the area of downtown Utica, we're at 209 Elizabeth Street, and we'll be here until 5 p.m. We've got Fidelis here to entertain the crowds while you're waiting for your free cleaning and screening, kids ages 1 through 12. And also just kids who have dental coverage tend to see a dentist more regularly, on a regular basis. And so, in New York State, most kids up to age 19 do qualify for free or low-cost health coverage through Child Health Plus, which we offer at Fidelis Care. So if you need any more information about enrollment, which you can do throughout the year, you can call us at 1-888-FIDELIS or visit us online anytime at fideliscare.org. Thanks so much. Bye.